What do you do when you're doing the exercises for your back for L4, L5 disc bulge, and it's helping some and giving you relief, but you still have pain? It's not 100% resolved. That's the topic and the theme of today's Ask Dr. Walter segment, and as part of this new video series that I'm doing, okay? So I'll get to that in a moment right here. So what this series is about, Ask Dr. Walter, is every day I'm gonna upload a short video about 3 to 4 to 5 minutes answering either 1, 2, or maybe even 3 questions, depending on the amount of time that I have that day. And basically, if you leave a question in my comments, or when you leave a question, you may be the next question that I'll be answering on this video segment, okay? So uploaded each and every day, so do follow along. I'll put the playlist at the end in the end screen like this. You can see the playlist as well. So here is today's question. Let's get right into it. This is by one of my followers whose YouTube handle is Chill Time with Prajwal Games. Cool handle, by the way. Okay, so this is what the question says. Dr. Walter, I am having L4, L5 disc bulge since 1 year. I'm doing some of the above exercises. Pain was reduced in my leg, but still I'm having severe pain in my lower back and in spine region. Is there any suggestion? What a great question. There's a few things that I can actually talk about in this question when I answer it. So number one, doing exercises can be very helpful. You'll find a ton of exercises on my channel for the lower back and for the neck to help with a variety of different conditions. They can be very, very useful to help to prevent some of the problem get worse and help to even give relief, okay? Not every exercise is going to be suitable for every single person and every single condition, and it should always be done to tolerance. And to be 100% sure what exercise to do, you should get a checkup first by a health professional so you know which exercises should be done specifically for you. But nonetheless, this follower here, they're doing the actual exercises and it's helping. Now, one of the good things that came out of this so far for this individual is that the leg pain is gone. Okay, so it says, or reduced. The leg pain is reduced. So when the leg pain is reduced or even resolved, and there's more pain in the actual back region, that's actually a normal response to healing. So when there is leg pain, that's called peripheralization. So when there's leg pain related to a back condition, that's called peripheralization. It means the actual problem is getting worse. It's either referring or radiating from the source, which is the lower back region. Now, when the pain in the leg is reducing and it's increasing in the origin area, which is the lower back region, that's called centralization. So centralization, that means that now the actual problem is not progressing, it's actually improving. So it's very common, I see this with a lot of my patients, it's very common that the leg pain, which should be resolving first, will reduce, and back pain does actually increase. Okay, so that means that you're on the right track. You're on the right track. Keep doing what you're doing. The inflammation is subsiding. The tissues are healing. Your back is healing. So keep doing what you're doing when you find yourself in that situation, okay? Now, if you're doing exercises and your situation has plateaued, your pain condition has plateaued, perhaps that's the best you got with those exercises, okay? Nothing wrong with that. That's good. I've had a patient that watched my videos, came to my office and said, Dr. Walter, did a bunch of exercises. I'm about 80 to 90% better. He said, thank you for the videos and the exercises, but I want to be 100% better. So it's possible that you may require some professional treatment and professional guidance with a chiropractor or a physiotherapist that can do rehabilitation type work, a spinal corrective type work to actually get you to that top-notch improvement, perhaps even 100% improvement, or at least better to where you're going, where you are from this point forward, okay? So there are situations that professional treatment will be required on top of your home exercises, okay? If the home exercises resolve at 100%, great, you're done. If you want extra work on it, then you need to seek some other care from a professional like a chiropractor or a physiotherapist. So nonetheless, and just summarize in answering this question, when there's reduced leg pain and more back pain, it means you're on the right track. That's a natural course of healing for lower back conditions. So that's today's answer for episode 3. Do continue on right there. There's a playlist. If you missed the other episodes of Ask Dr. Walter, I'm going to put them all one in order. So 1, 2, 3, 4, all the way down the line. Go ahead and watch them right there so you don't miss out and you can binge watch them, and be sure to share them. And if you have any questions, leave them in the comments below.